Two hands, the left and the right. Hold him up high, so clean and right. Two, three.
Ang ating mga kamay, hindi mabilang sa daliri ang mga hatid na pakinabang sa ating kalusugan. Learn more about pressure points and its ability to heal the mind and the body.
Rest. Take a rest lang po.
Pag masakit ang ulo ko, minom po ako ng paracetamol or mefenamic.
Sleep lang, then I'm taking some medicine.
Today we'll be talking about some various common aches and pains that some of us may experience frequently and how you can apply acupressure points that can help relieve it. Acupressure originated in ancient China thousands of years ago under the umbrella of traditional Chinese medicine. Both acupressure and acupuncture are based on the same fundamental principle of targeting points or combination of acupoints by either manual pressure or by very fine acupuncture needles. This will then stimulate the autonomic nervous system or send signals to the brain to jumpstart the body's self-healing process or regulatory mechanisms. It is based on the theory of qi, or the vital energy flowing through various pathways throughout our body called meridians. Chinese medicine believes that whenever there are any blockages in the natural flow of qi, disease or illness will emerge. Headaches are usually described as pressure in the head that's either throbbing, constant, sharp, or dull. Headaches can also differ greatly in regard to the pain type, severity, the location, and the frequency. You can try some of these acupressure points to relieve headaches. First is Li4, or large intestine 4, also known as Hugu in Chinese. This point is located on the web between your thumb and the index finger. So you can start by pinching this area with the thumb and index finger of your opposite hand firmly, but not painfully, for about 10 seconds. Next, make small circles with your thumb on this area in one direction and then the other direction for about 10 seconds each. And then, repeat this process on your opposite hand.
Doc, every morning po kasi, lagi akong sinisipon. Tapos, parang naging allergy na siya para sa akin. Kapag tuwing umaga, sisipunin ako tapos, yun, mabigat sa ulo, masakit. So, anong pwede kong gawin para mabawasan yung sakit ng ulo?
We have bladder 2 or BL2, or also known as Guangsu. This is located on either side of the spot where the bridge of your nose meets the ridge of your eyebrows. Use both of your index fingers to apply firm pressure to both points at once. Hold for about 10 seconds. Make sure to deep breathe, release, and repeat. Touching these pressure points can relieve headaches that are caused by eye strain, sinus pressure, or sinus pain.
Next question ko, Doc. Hingi po kasi ako ng tip. Palagi akong nag-spend ng siguro 4 hours to 5 hours ako nag-game sa phone. Minsan nakaka-experience na ako ng mga pain dito sa may neck part. Sumasama na siya, pumakit na sa ulo. Sumasakit na rin. So, ano pong pwede kong gawin?
So this is actually a very common problem nowadays, since all of us spend a lot of time on the cell phone. And the problem here is when you're on the cell phone and you're looking down, it causes an abnormal angle to our necks, and that causes the neck strain in our neck muscles. And a lot of times that will radiate and also cause headaches. Another good point is known as GB20 or gallbladder 20 or Feng Shi. Located at the base of the skull in the hollow areas between the two vertical neck muscles. Place your index and middle finger on either hand onto these pressure points. Firmly press upward on both sides at once for 10 seconds, then release and repeat. Applying firm touch to these pressure points can help relieve headaches caused by tension in the neck.
Palagi po kasi akong puyat, late ako nakakatulog dahil nga sa mga thoughts, tapos dahil na rin sa work, medyo stress din sa mga bagay-bagay. So dahil doon, Katulad ngayon, wala akong masyadong tulog ngayon. Kaya ang bigat medyo mabigat yung ulo ko ngayon. Sa totoo lang. Ano pong pressure point ang pwede kong massage?
Then we have the yin tang point, which can be found between your two eyebrows. This is a very good and effective point for headaches, calming the mind, as well as insomnia. For this one, use the index finger of one hand to apply firm pressure to this area for 1 minute. Firm pressure applied to this third eye pressure point is thought to relieve eye strain and sinus pressure that often causes headaches. Lastly, we have GB21, located at the edge of your shoulder, halfway between your shoulder point and the base of your neck. To use this pressure point, use one thumb of one hand to apply firm circular pressure to this point for about 1 minute. Make sure to inhale, exhale, then switch and repeat on the other side. Applying firm touch to the shoulder well pressure point can help relieve stiffness in your neck and shoulders, relieving neck pain and preventing headaches caused by this kind of sensation. Avoid this point along with LI4 in pregnant women as it can induce contraction.
Make sure lang na walang TV, hindi press ko yung paligid ng kwarto nila.
Usually, I put them in my chest.
I'll drink paracetamol.
I sleep and take a rest lang po.
I go outside.
I drink coffee.
For our mommies out there, here's a pro tip for our little ones to sleep better. Dealing with babies that refuse to go to sleep can be incredibly frustrating for a parent and also very exhausting. If you've already tried white noise, swinging, swaddling, and lullabies with no sleep in sight, you might want to try some acupressure points. Just like with one of the popular points for adults, you can also try this on your little ones. Starting with yin tang, the point right between the eyebrows, a spot often nicknamed the sleep button. For babies, you just want to give a very gentle and slow stroke on that point, which can be very calming. You can try little strokes with the fingertip going downward toward the nose. If the baby is very cranky and can't get comfortable in a cradle hold, you can also try the football hold and gently work the baby's back to help them settle down. You can use your thumbs and gently press on either side of the spine about a thumb's width or two away from the spine. Press very softly for a few seconds and then work your way down. This has been Dr. Kevin Giller, your healthcare and technology buddy. For more educational videos, subscribe to our YouTube channel at HCT Academy. Until next time!
Buti na lang anak, kakapanood mo ng I have two hands, the left and the right. Nalaman natin ang tungkol sa acupressure. Tara na! Praktisin natin yan kay Daddy. Let's go!
For acupressure, physical pressure is applied to certain points on the body, depending on the complaint, to open the flow in these meridians to bring the body back to a balanced state of well-being. It can be quite effective, it's easy to learn, and it doesn't cost a thing. If you felt like your stomach is upset or you feel nauseous, it could have a wide range of causes. But here are some acupressure points that you can try next time if you feel uneasy. Next, we have large intestine 4, or LI4, also called Higu. This is known as the joining valley and is the main point for dissipating pathogenic heat and sedating pain. This is a powerful point in that it has many indications. It's good for post-operative nausea and vomiting. Make sure to avoid this point as well in pregnant women as it can induce contractions. So to find this point, you want to find the highest spot on the muscle between your thumb and index finger. This is the area where your thumb connects to the fingers, okay? So this area will bulge out slightly when you bring your thumb and finger together. LI4 point is located about a half an inch inward on the back of your hand. Apply pressure to this area and then repeat on your other hand. Then we have spleen 4 or Gong Sun. From this point, the collateral of the spleen meridian connects with the stomach meridian. So it's a main point for gastrointestinal diseases, stomach ache, abdominal pain, vomiting, and diarrhea. So sit down and pull one foot onto your knee so that the inside of your foot is facing you. Slide your hand from your big toe to the side of your foot. You should feel a slight downward curve on the foot in the S4 point. Next, we have another powerful point in promoting overall wellness and vitality, stomach 36, or Zusanli. It is excellent for almost any digestive complaint, as well as increasing energy and boosting your immune system. So for this point, sit down and place your hand on your kneecap. Press the spot where your pinky finger is resting. The pressure point for nausea is located on the outside of your shin bone, just below the knee. Apply firm pressure in a downward motion. Make sure to take deep breaths for about 10-15 seconds, and then repeat on the other side. The next point is named Conception Vessel 12, or CV12, or Songwan. This point is particularly good for when you have acid regurgitation or that acid reflux, or stomach ache, vomiting, or hiccups. It's known to stop what we know in Chinese medicine called rebellious qi. So take about 4 finger breaths above the umbilicus in the midline. Then with a thumb, place it in there in the midline. Again, apply firm pressure in a downward motion. Now remember again to always take deep inhale and slow exhale.
Use my inhaler, personal inhaler.
Water therapy lang po.
I'll drink more water lang po.
While there are nasal sprays and medications to treat the symptoms, there's also some simple, natural acupressure points that may provide you with a more natural relief. First, you can start with a general sinus massage. To start, place your 4 fingers on each of your temples and gently massage in a circular motion. If you feel a tense spot, hold and breathe for several seconds. You can continue along parts of your forehead and hairline. Next, take your thumb and index finger and place them on your eyebrow closest to your nose while gently pinching down. Hold this position for several seconds and then slowly work your way across the eyebrow toward your ear. Then take 4 fingers and place them on the inside of your cheekbone near the bottom of your nose. Gently press and drag your fingers slowly outward. Repeat this several times. As you finish toward the outside of your ear, gently massage the temporal mandibular joint, or TMJ, which connects the lower jaw to the skull. If you can't find it, open your mouth and you should be able to feel a slight protrusion. BL2, or bladder 2, or also known as Quanzu, which is located on either side of the spot where the bridge of your nose meets the ridge of your eyebrows. Hold for at least 10 seconds, release, and repeat. LI20, large intestine 20, located at the base of your nose. Place your index finger on each point and apply slight pressure and circular motions. Next, we have SI18, located where your cheekbones meet your nose, directly below the outer eye canthus. Again, you know what to do. Apply slight pressure or massage in a circular motion while taking deep breaths. Next, kumusta? How are you feeling now?
To be honest, Doc, sobrang effective niya. Kasi nung dumating ako dito, ramdam ko mabigat yung ulo ko, gawa ng pagod. Pero after ng mga ginawa natin, na-relax ako eh. Actually nga, medyo inantok ako kanina eh, kasi na-relax talaga ako. Grabe, Doc, sobrang thankful ako sa mga tinuro mo.
This has been Dr. Kevin Giller, your healthcare and technology buddy. For more educational videos, subscribe to our YouTube channel at HCT Academy. Until next time!
Buti na lang anak, kakapanood mo ng I have 2 hands, the left and the right. Nalaman natin ang tungkol sa acupressure. Tara na! Praktisin natin yan kay Daddy. Let's go!